Today, I would like to talk to you from my second speech about COVID-19 and the mental health crisis. And first of all, I'm going to start by talking about how mental health has generally been affected by the pandemic. Then after that, I'm going to look at mental health more generally. And then I'm going to have a look at some ways in which we can maybe improve the situation. And I'm going to take a look at two countries in particular, which are the countries I know the best, the UK and France. So I'm going to start with a few figures. I'm sorry about that. More than two-thirds of adults in the UK, 69%, say that they have been worried about the effects of COVID on their lives. 63% have said that they are worried about the future, and 56% say that they are stressed and anxious. This is taking into account pre-pandemic trajectories. Mental health has actually worsened by 8.1% over the course of the pandemic. And apparently young adults and women are the hardest hit. According to UCL's social study, which was conducted among 90,000 UK adults, levels of anxiety and depression actually fell in early June as the lockdown eased, but they increased again during the second lockdown, during the winter. People who are especially affected by this are people with lower household incomes and people with diagnosed mental conditions, which is what you would expect. Psychologists in France and the UK have been saying for quite a while now that the situation has become very serious. They've been trying to raise the alarm for some time. They have been saying that more and more people have been coming to their clinics with severe depression and severe anxiety. They've been saying that people are coming to them, saying that they can't see a future, that they are really struggling. So that in and of itself is very worrying. The Scientific Council in France, the Conseil Scientifique, which gives directives on health, does not include not a single psychiatrist. So not a single psychiatrist is part of the Conseil Scientifique in France, which gives directives on health in that country. In fact, what is really worrying is that measures are only taken whilst bearing in mind physical health. Mental health is never taken into account when measures are being taken. These include COVID-19 measures. People say that mental health is an important factor, but as we can see from the example of the Conseil Scientifique, mental health is rarely taken into account when it comes to COVID measures. In fact, psychiatrists have been saying for some time that they fear waves of mental health crises. They fear that these waves are going to occur shortly because of the pandemic. Indeed, 7 months ago, a report came out in France saying that there has been a dramatic increase in cases of depression, anxiety, and suicidal thoughts in France. Similar studies have been conducted in Asia and America, and the results have been largely similar. How can we explain all of this? Well, we can talk about the health situation and we can talk about the economic situation. With regards to the health situation, people are scared, obviously, of falling ill. They're scared of passing the virus on to others. They're also scared measures, particularly the isolation measures, will affect them and their families. When it comes to the economy, people are scared of unemployment, they're scared of bankruptcy, they're scared of falling into precarious situations. And then people who have caught COVID are actually at greater risk of developing depression and anxiety. I would like to break some of these factors down and have a look at some in particular. First of all, we have the factor of social isolation. We have many people, both in the UK, France, and all around the world, who live alone. They haven't been able to go out or see people during the pandemic. You have students in student housing who have not been able to go out and see their friends or make new friends if they're first year students, for example. I'm sure we can all remember that time when we were students doing our undergrad. I think there is a lot of anxiety to do with going to university. A lot of us are anxious that we won't be able to make friends. We're anxious about moving away from home for the first time. We're anxious about missing our parents and feeling alone. And you can imagine that these anxieties have been exacerbated over the course of the pandemic because people haven't been able to meet people make friends, and socialize. So you have that side of it as well. Then actually another very sinister aspect linked to social isolation is domestic abuse. Many people have been locked at home essentially with their abusers. In fact, a report by MPs in the UK showed that in the first 3 weeks of the pandemic, 16 people, 14 of which were women, 2 of which were children, were killed as a result of domestic abuse. So that gives you an idea of how serious the situation is. Indeed, calls to national helplines increased by 49% during the first few weeks of the lockdown. Secondly, we have the aspect related to jobs and financial losses. The Mental Health Foundation in Britain stated that over a third of the people in full-time jobs were concerned about losing their jobs. And the mental health impact on unemployed people has become extremely exacerbated over the course of the pandemic. Apparently, according to this same survey by the Mental Health Foundation, a quarter of people say that they are not coping well with the stress of the pandemic. And half of the people surveyed said they were worried about not having enough food or enough money rather, to meet basic needs. A fifth of the people surveyed said they had experienced suicidal thoughts. I think that's the figure that really jumps out of this survey. Evidence goes to show that working and even volunteering can really improve our mental health. Exercise can also improve our mental health, but of course we haven't been able to do many of these things because of the pandemic. You also have another aspect relating to housing insecurity and housing quality even. People who rent are at greater risk of experiencing mental health issues relating to their housing situation. For example, in the UK, 1/8 of people, so 12%, have no access to a garden. And you can imagine that having access to a space like a garden is really an asset in a situation like the one we've been living in. Frontline workers have also been disproportionately affected by the mental health impact. These people have had to deal with seeing many of their patients die from COVID. They've also had to deal with other patients suffering from panic attacks and the like, and this has had an impact on their mental health. Then there is also the loss of coping mechanisms. Coping mechanisms have diminished because of the pandemic. These are mechanisms like staying in touch with family and friends, exercising, going to work. Of course, many people have lost their jobs or been furloughed because of the pandemic. Exercise has been limited. We've not been able to meet up with people. This has all had a really serious impact on people who have existing mental health conditions, not to mention people who have developed mental health conditions as a result of the pandemic. There is one particular mental health condition which is a particular concern. It is called borderline personality disorder. And people who suffer from this illness have a constant fear of being abandoned. They have a constant fear of losing people that they love and being left all alone. And it's almost this existential fear in their minds. And people with this condition have sadly been very sorely affected by the crisis because they have not been able to see many of their family members or their friends. And as you can imagine, this has exacerbated feelings of abandonment and loneliness. Also, you have the reduced access to mental health services. Services were already stretched before the crisis, and then we had lockdown. The Royal College of Psychiatrists in the UK stated that almost half of the psychiatrists working in the UK have seen increases in urgent and emergency cases during lockdown. And paradoxically, you have also had a drastic drop in the number of appointments being offered to patients. Often people have been staying away from these services. They've been staying away until they have reached crisis point, and this could lead to a flood of exacerbated and untreated mental health cases after the pandemic. Providers have also been reporting on significant increases in demand and severity. The charity Mind, for example, reported that a quarter of people who tried to access mental health services in April failed to get any help at all, which is extremely, extremely concerning. So we've had a look at the causes. I'm sure they didn't come as a surprise to anybody. And I'm sure by now I've painted a very bleak picture. But before I go any further, I would just like to point out that there are things that we can do. And actually, these are very simple and easy things that we can do to improve the situation. Before I do so, I would just like to mention that certain specific mental health disorders are particularly affected by the crisis. 73% of people who suffer with eating disorders have been affected. 72% of people who suffer from PTSD, post-traumatic stress disorder, have been affected. And 72% of people with OCD, obsessive compulsive disorder, have been affected by the pandemic. The people who have been most affected are the people with personality disorders. So 77% of people with personality disorders have said that their condition has got worse as a result of the crisis. So what can we do? First of all, we can start by raising more awareness of the situation and providing people with more information. Destigmatization is, I think, is extremely important. People often say that in the 90s, cancer was a taboo. Nobody dared to talk about cancer. And yet now so much progress has been made to destigmatize cancer that people who work in this domain are proud to say that they work in the domain of cancer. They are proud to work to help people who suffer from cancer. They are proud to work in research. And I think we need to do the same with mental health. There's often a perception that talking about suicide, for example, could actually prompt people to attempt suicide. But actually, figures show that actually, if we talk openly about things like suicide or mental health conditions, this can actually work as a relief to people going through these difficult times. Speaking about things openly ensures that people don't feel ashamed of what they're going through. It ensures that they feel listened to and accepted and welcomed. So destigmatization is extremely important. I think we also need to destigmatize certain labels. Often we try and pigeonhole people and put them in certain categories. Such and such a person has OCD, such and such a person has a personality disorder. But how much do we actually understand about these disorders? I think the whole idea of information and awareness is so important. People need to be made aware that these illnesses exist, that they are nothing to be ashamed of. And also we need to try and help people who have friends or family members who suffer from these illnesses. We need to support them. We need to help them know how to help those who they love who suffer from these illnesses. So that is also very important. Of course, this is all quite difficult in the midst of a global pandemic. Everyone is talking about COVID. But maybe especially in the midst of a pandemic, we need to be talking about mental health, because often the problem is that people don't feel heard and understood or accepted. So we need to help people, we need to provide information, we need to lend awareness. And lastly, this will also be my conclusion, governments need to do more. We often hear people in government say that mental health is just as important as physical health. But if that was the case, would they not be spending almost the same amount on mental health that they do on physical health? The question remains to be answered. But in some countries, only 2% of the health budget is dedicated to mental health. France and the UK are doing better. 11% of the health budget is dedicated to mental health, but it is still not enough. I think we need to do more. We need to do so much more. And finally, I think we need to show compassion to those struggling with poor mental health. So that was my conclusion. And I'm sorry that it wasn't particularly uplifting. I tried to make the end a little bit more uplifting because I think there are things that we can do to help people who suffer from mental health. But I hope that the speech was interesting. Thank you.